Joy Milne noticed something was wrong with her husband in 1982. Not tremors, not stiffness, not any of the symptoms you'd read about in a medical textbook. A smell. His lovely male musk smell had got this overpowering sort of nasty yeast smell, she recalls. A deep, musty, fatty smell. For 12 years, she nagged him about it, told him he wasn't showering properly. He'd get angry, stomp off. She had to just let it go. 12 years. Then in 1994, Les was diagnosed with Parkinson's disease. But here's where the story gets interesting. Fast forward to 2005. Joy and Les walk into a Parkinson's support group meeting. They're late. The room is full, and Joy smells it. Everywhere. I walked into the room and I thought, smell! She turns to Les, a retired doctor, and they both realize everyone in that room had the same smell as her husband. They understood the significance. Immediately. But think about what that means for a second. Joy had been smelling Parkinson's disease for over a decade before anyone knew it was Parkinson's. Before the tremors, before the diagnosis, before any doctor could detect it. She could smell the disease years before it appeared. Now, if you're a scientist, this sounds absurd, right? Diseases don't have smells. Or do they? In 2012, Joy attends a talk at the University of Edinburgh. The researcher, Dr. Pilo Kunath, is presenting on Parkinson's. Joy stands up during Q&A and asks, "Why are we not using the smell of Parkinson's? I can smell it in this room all around me." Kunath's reaction? "I just dismissed it, I have to say. It just didn't seem possible." But he couldn't stop thinking about it. He'd heard about dogs detecting cancer. What if? So they designed an experiment. 12 t-shirts, 6 from Parkinson's patients, 6 from healthy people. Participants wore them overnight. The shirts were randomized, numbered, put in a box. Joy, completely blind to which was which, smelled each one. The results? She correctly identified all 6 Parkinson's shirts. Perfect score. But then, she identified one control shirt as having Parkinson's. The researchers marked it as her one mistake. 8 months later, that control subject contacted them. He'd just been diagnosed with Parkinson's. Final accuracy, 12 out of 12. 100%. So, scientists dug deeper. What was Joy actually smelling? They focused on the back of the neck, where Joy said the smell was strongest. Not the armpits, not sweat, something else. Sebum, the oily substance your skin produces. Working with mass spectrometry experts at the University of Manchester, they identified the molecular signatures. 4 primary compounds: perylic aldehyde, downregulated in Parkinson's patients, icosane, hippuric acid, octadecanol, all upregulated. By 2022, analyzing 150 participants, they'd found 500 compounds unique to Parkinson's patients. They developed a 3-minute skin swab test, 95% accuracy. But here's the question that haunted the researchers. If Joy can do it, why can't we train others? They tried. They couldn't. Joy has hereditary hyperosmia, a rare genetic variant for heightened smell passed through her maternal line. Her grandmother had it, her grandmother's mother had it. As a child, her grandmother trained her to identify rose varieties by smell alone, with a warning: don't tell anyone, they'll think you're a witch. At 6 years old, Joy could smell things other people couldn't. Now she can detect Alzheimer's, smells like vanilla. Cancer, earthy smell. Diabetes, tuberculosis, she can smell Parkinson's on strangers in public. But she signed an NDA because medical ethicists told her it's unethical to inform them. Her ability is incredible. It's also completely unscalable. So here's the pivot. If humans can't learn to do what Joy does, what about dogs? Dogs can already do this, and they're frighteningly good at it. Lung cancer, 97% accuracy. 3 beagles, 8 weeks of training. COVID-19, 97% accuracy from sweat samples, and they detected infections 48 hours earlier than PCR tests. Parkinson's disease, 80% sensitivity, 98% specificity, up to 20 years before symptoms appear. Let that sink in. 20 years. Joy smelled her husband's Parkinson's 12 years before diagnosis. Dogs can detect it 20 years out. Dogs detect breast cancer, prostate cancer, ovarian cancer, malaria, tuberculosis, epileptic seizures, hypoglycemia in diabetics. The list goes on. Medical Detection Dogs in the UK has trained over 50 assistance dogs. The Penn Vet Working Dog Center in Philadelphia has 31 working dogs in various training stages. Auburn University just won a $24 million contract from Homeland Security for explosive detection. And the numbers? Dogs can detect odors at parts per trillion. That's 1 teaspoon of sugar in 2 Olympic-sized swimming pools. So here's the uncomfortable question. If dogs are this good, why are we even trying to build machines? Because dogs have problems. Training time, 6 months to 2 years per dog. Cost, $50,000 to $60,000 for specialized medical detection dogs. Working limitations, they need breaks, they tire, performance drops at night. One study showed detection accuracy dropping to just 22% during the handler's sleep, and they can only work for 5 to 7 years before retirement. You can't scale that. You can't put a detection dog in every home, every clinic, every airport screening line. But here's where this gets really interesting. MIT researchers found that dogs are 200 times more sensitive than artificial noses at the molecular level, but they're also, quote, 100% instinctive at specific chemical identification. Think about what that means. A dog walks up to a breath sample and says, cancer. That's it. They can't tell you which cancer, what stage, where it's located. They detect a pattern instinctively. AI could potentially tell you, stage 2 adenocarcinoma, left lung lobe. Dogs smell sick. AI could smell this specific disease, this specific progression, this specific molecular signature. We're trying to build a different kind of sensing entirely. Dogs screen, AI could emphatic diagnose. And unlike dogs, AI doesn't tire, doesn't need breaks, can analyze thousands of samples per hour, can operate 24/7 for decades without retirement, can be deployed globally, instantly, through software updates. The question isn't, can machines be better than dogs? The question is, can we build something that combines dog-level sensitivity with machine-level specificity and human-level scale? And that brings us to the technology itself. Electronic noses work through arrays of sensors, 8 to 64 sensors with overlapping selectivity. When volatile organic compounds hit these sensors, each sensor responds differently. The pattern across all sensors creates a unique fingerprint. Machine learning algorithms analyze that fingerprint. It's similar to how your nose works. You have about 400 different receptor types, and your brain interprets the pattern across all of them. But the breakthrough came from Google in 2019. A team led by Alexander Wilczko did something remarkable. They taught AI to predict smell from molecular structure alone. No physical sensors, just the chemical formula. They used graph neural networks, treating molecules as mathematical graphs where atoms are nodes and bonds are edges. The network learns to create an odor embedding, a 256-dimensional space for smell. Think of it like color space for vision. RGB values tell you what color you'll see. This odor space tells you what smell you'll perceive. They trained it on about 5,000 molecules, then they tested it on 400 completely novel molecules, never seen during training. 15 trained human panelists rated each one. The result? The AI matched the panel average better than 53% of individual panelists. The AI was more reliable than the median human, and it could do something humans can't, predict 70 person-years of smelling time in seconds. By 2023, they'd created what they call the Principal Odor Map, published in Science, the first unified map of human olfactory perception. They identified about 500,000 potential odorants that have never even been synthesized. The AI could tell you what they'd smell like before anyone's made them. This technology is already deployed. NASA has an electronic nose on the International Space Station, monitoring astronaut health. TSA uses electronic nose technology at over 460 airports for explosive detection. The food industry uses it for quality control. One system has made over 1 million measurements per year since 2008. But here's the philosophical question. Is it really smelling without subjective experience? When you smell vanilla, there's something it's like to be you experiencing vanilla. That's called a quale, the subjective quality of experience. When AI processes vanillin's molecular structure, it outputs coordinates in 256-dimensional space and predicts descriptor probabilities. There's no experience, just calculation. But functionally, the AI is doing something humans can't. It's building a different kind of chemical sensing that happens to correlate with human perception, and that's going to change everything. Imagine this, a device in your home. You breathe into it every morning. Takes 30 seconds. One day, it detects pancreatic cancer, stage 0, years before you'd feel anything. Your lifespan transforms. This isn't science fiction. The technology exists. Dogs detect Parkinson's 20 years before symptoms. Electronic noses detect lung cancer with 96% sensitivity. The 3-minute skin swab for Parkinson's is 95% accurate. Early detection could mean intervention when 0 to 10% of dopamine neurons are lost, instead of the current standard, 60 to 80% already lost by the time you get diagnosed. But here's where it gets complicated. If we cure diseases that killed us at 60 to 80, do we just get new diseases at 100 to 110? Are we identifying finite diseases or revealing that aging itself produces infinite biochemical variations, each detectable, each requiring intervention? When scientists studied 150 Parkinson's patients, they found 500 unique compounds. The Principal Odor Map identified 500,000 potential odorants. We've characterized about 5,000 molecules total. That's 0.0000125% of the estimated 40 billion odorous molecules. And here's the really uncomfortable part. AI can only smell what it's trained on. COVID-19 exposed this. Dogs could be trained to detect COVID in 1 week, achieving 96% sensitivity. But that's after we knew COVID existed, collected samples, trained them. For the first 2 to 3 months of the pandemic, when we needed detection most, we had nothing. When a truly novel pathogen emerges, producing volatile compounds never cataloged, the AI is blind. Worse, it might be confidently wrong. It'll give you an answer, but if the molecular structure falls outside its training distribution, that answer is meaningless. Dogs have a different advantage. Joy Milne recognized something different even without knowing what different meant. Dogs can generalize to patterns they've never been trained on. AI detects presence. This matches training sample 4,892. It can't detect absence. This is unlike anything I've seen. But the final twist is the one we should have seen coming. Medical AI has a bias problem. Dermatology AI showed a threefold disparity in cancer detection. Sensitivity of 0.69 for light skin, 0.23 for dark skin. Northwestern University found AI assistants actually exacerbated accuracy disparities by 5 percentage points. Pulse oximeters, standard since the 1980s in nearly every hospital, Black patients are 3 times more likely to suffer from undetected low oxygen. We've known this for years. It's documented in peer-reviewed journals. We still use them. A healthcare algorithm used on over 200 million people in the US systematically predicted lower risk for Black patients even when they were considerably sicker. Only 17.7% of Black patients received additional help. Should have been 46.5%. Now imagine this with breath-based cancer detection. Your neighbor, represented in training data, cancer detected at stage 1. 5-year survival rate, over 90%. You, underrepresented in training data, same cancer, similar signature, but slightly different due to genetics, diet, environment. AI confidence score, 23%. Below clinical threshold, no further testing. Cancer detected at stage 3 when symptoms finally appear. 5-year survival rate, 30%. Early detection becomes healthcare inequality. The people already most likely to survive get saved. Everyone else? Same outcomes as today, just with more false confidence along the way. And here's the kicker. It's a feedback loop. Biased AI leads to disparate care. Disparate care creates more biased data. More biased data makes AI worse. The cycle amplifies over time. So, can AI smell? Yes. The 2023 science paper proved it, matching human consensus better than half of individual panelists, predicting 70 person-years of smelling in seconds. But should we detect everything? If every breath reveals a biochemical signature, every signature suggests an intervention, where does it end? Do we medicalize normal aging? Create anxiety about conditions that might never progress? And who gets to breathe easy, while others hold their breath? Joy Milne's husband Les died in 2015. His last words to her, "You won't let this go. You will do it, won't you? You promise?" She spent the last decade working with scientists, helping develop that 3-minute test, trying to turn her rare gift into something that could help millions. The technology is incredible. It's also complicated. Dogs can detect disease 20 years early. AI can identify molecular signatures at parts per trillion. Electronic noses can screen thousands of people per hour. But if we deploy it without solving the bias problem first, we won't be saving everyone. We'll be saving some people. And the gap between some and everyone will be determined by who is included in the training data. We can smell the future. The question is, whose future are we smelling?